technique, as I call to this kind of management, because we will use different techniques to achieve solution to the patients, especially patients with problems in the biliary tract, and moreover when they have injury in the biliary tract. So this is a 16 years old woman that was have a past history of cholecystectomy in May of last year, and this patient have had um, biliodigestive anastomosis because a surgical complication, you know, and in November start to perform high levels of bilirubins and cholangitis, and then was sent to us in January to be treated by us. What we saw is that the biliary tract was divorced a little bit, and you can see here the left. You see two pigtails. Both pigtails, 7 French, 7 centimeters, were performed by US in January in our center. So you can see a drainage of the right biliary tract and the left biliary tract, and was successful. So now we have a fistula created by both sides, and I will try to go to the anastomosis because I believe this patient probably could have a double anastomosis, one in the right biliary tract and the second in the left biliary tract. I'm not so sure, or probably just one. So we need to see that, and I will use first a cholangioscope to go inside the biliary tract, the left biliary tract. You see now the guide wire. I pass my guide wire through the fistula, okay, and I will show you a little bit how to do with the stent, and then how to do with the cholangioscopy. So I will remove the stent using a rat tooth biopsy forceps. I am using now a duodenoscope. So just to summarize, we first perform a US hepatico left and right gastrostomy, and we perform a fistula with the plastic stents. Now I will use a duodenoscope. Okay, so my goal now is to remove the stent. Less the biliary tract abre. So you see the rat tooth now. Necesito en grande la endoscopía. So you see the other stent there. You see I'm using the rat tooth. Cierra. So you see. So you don't need to move. Huh? I confirm by fluoroscopy, and then I will remove. You see here. Perfect. So la imagen fluoroscópica, por favor. You see, I remove completely. Okay, now, libera. I will less in the stomach. Cierra. Okay. I will less in the stomach. I have my guide wire, and I will pass a balloon for dilation. I need to perform a dilation before to go inside. Even if we had a 7 French, because I will use now a 9 French cholangioscope. If you will use a 7 French cholangioscope, you can pass directly. But the problem with 7 French is that I need to use a 0.025 guide wire. So now I have a 0.035, and I will try to use my 9 French cholangioscope. So these steps are very important. Okay, so now the bilirubin parameters now of the patient is good. She doesn't have cholangitis, and this is very good. So this tell me that I remove the patient from cholangitis, and now I need to solve the problem, and I will try to do that. So we will start to perform a balloon dilation. Dilata. Todo. Te sigo esperando. No, estás metiendo contraste. No estás dilatando. Estás en inyección. I'm sorry, my technician is not so efficient sometimes. It happens just in Ecuador. In other part of the world, they are perfect. I'm sorry. Segundo. Un momento. Segundo. Let me see. Desinfla un poquito. So I need to deflate. Now, ahora sí, dilata. So it's very important the position. Un momento. Sí, sigue. Sigue. So now we have a very good pressure. So we delayed everything. And I still have a small stenosis. I will wait a little bit. Is this balloon pass? So in theory, I will arrive to pass my cholangioscope. So now I will deflate. That's the idea. I need to see what is happening inside the biliary tract. The infla. Okay, so now 10. Okay, dilata. I will do a dilation inside also the biliary tract. I think it's important. And I see there is a communication. Okay, perfect. Okay. So desinfla. Un momento. Un momento. So you see, I saw some small pass of contrast. So I want to see what is going on inside. Okay, so I will let my guide wire here. It's okay. I will pass now my cholangioscope. To see what is going on inside through the fistula. Okay, so now I will pass the cholangioscope. So I am using a Nice French cholangioscope from IMAX, from Microtech today. It's very important that your technician, well, the technician needs to be good. I don't have too many good technician, but it's okay. Huh? Sometimes it happens. Huh? So now, oh my God, ¿qué pasó? Un segundo. So now you see small movements, and it's very important the movement that you will do to go inside. 10. Moment. So I am inside the Biliary tract. Huh? It's not a big Biliary tract, but I believe I will pass. There's some inflammation. It's normal. You see? Sometimes you need to help yourself with the scope. So I want to see where I am. And I need to see what is the damage that this patient have, you know? This is very important. It's very important because we give a lot of information to the surgeons regarding what is going on, and we have also a lot of information that what can we do, you know, regarding this kind of patients. We see inflammation here. So now, so you see, I see my other sender, and I believe there is a communication between them, and I believe that we can maybe we can arrive to see where is the anastomosis. Let me see where it is. Okay, so you see here in the Biliary tract. Let me see. You see in the Biliary tract the communication between both. And this is what I do by US. You see very well. So now I need to see if I found anastomosis. So at least I know that there is communication. And maybe this is the anastomosis. Pon contraste, por favor. Maybe this is anastomosis. I'm not so sure. So I will pass contrast now. See? So what is this? Moment. Dame la guía. I think this is anastomosis. Maybe I'm fine. Maybe I'm not so fine. So that's why hybrid techniques probably in the future could help a lot. No. Now we have nice. Let's see where I am going now. Because my situation is that I don't see the anastomosis, you know, the small bowel anastomosis. Photo. What is this? Let me see. Yes, maybe this is anastomosis, huh? Oh my god. I'm not so sure. Maybe this is anastomosis, huh? I'm trying to find out, huh? But I'm not so sure. This is my situation. So what I will do now is try to see. I'm not so sure. Huh? So what I will do is to pass a sphincterotomy and to inject to see if this is or not. If not, we need to. I need to just to perform to put a stent between the left and the right biliary tract, and then to send probably to surgery this patient. The other solution is to use magnets. Okay, let's go to see if there is and this was anastomosis or not. If I have the chance, that will be fantastic because I will recover the anastomosis. So my concern is that I don't see the air. There, you see? For the moment, I arrive to see that we have a communication, and then we can deal with this. And then maybe if there is no the anastomosis, maybe we can using magnets. We can put the magnet in the in the intestinal area that is near to the biliary tract, and then we'll perform a fistula. So I believe can be a good solution to avoid a new surgery in this patient. This patient already have 3 surgeries. So that is the deal. Let's see what's happening. What's going on? Ahí pasamos. Déjame inyectar. so sure. 10. 10. So I'm doing my injection, but I don't see nothing. You know what? Tenemos el 7 French. Ok, cambiamos la guía por una de 0.25. I will pass the 7 French colonoscope. Let me see if we can arrive to see that. So we know that the left and the right hepatic biliary tract are, there is communication. But now we need to see if this is anastomosis. If this is anastomosis, we can have a chance, you know, to avoid a surgery.
But I remember this case from before. I think you created the connection with the the stent from the right side of the liver. You created that communication because I don't, you remember that there was no communication and you put the bottom double pigtail. Now there is a communication because before there was not.
Yeah, probably. Yeah, not so sure. Yeah, probably.
And now is draining both sides.
Now it's raining both sides. Yes, there's a communication. Yes. I just need to see inside. It's not the same to put contrast. Sometimes it's easy, but sometimes not so easy. So now we will use a 0.025 guide wire, and we will use a 7 French colonoscope. I believe this will help to clarify what we need to do now. So if I, if I do a false tract, it's not a big deal because I will put a plastic stent again. I will remove that one from the right, and I will let just one, communicating the right with the left. Empuja, empuja. Okay, then I empuja. So why I will use a 7 French colonoscope is because you need to remember that the sphincterotom have empuja, 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 empuja. Déjame irme un poquito más abajo. So you see the fistula is here. So my idea now is I'm a little bit just with the 9 French colonoscope. Empuja. I'm not so sure that this is the biliary tract, but we will find out. Let's see what happened. Let's see what is going on. Empuja. So you need to remember that the sphincterotom have like a 5.5 French, but then it becomes like a 7 French, 6 French. So probably with the 7 French I will arrive to see better and pass through this area. I want to see what is going on there. But unfortunately we need to use a 0.025 guide wire. Very useful to have a 7 French colonoscope. That is when you do this kind of therapeutic, it's very important. Well, it's a big limitation. Even you have a 9 French colonoscope, you see how it's useful. So we have the fistula here. So now necesito la imagen del colangioscopio. Necesito la imagen de la fluoroscopía en pequeño. So now we are using a 7 French cholangioscope. See, it's easier to pass, you see? Easier to pass. Really easier to pass. Um, so then we pass, and I want to see. Oh my god. Okay, so to this. So now I am here. I'm trying to see what is this, huh? I'm trying to figure out what is this. Están aquí. So, yeah. Oh my god. Not so sure. This is the cavity, I believe. This is not. I can pass. Puedes pasar contraste.
Sí, contraste.
Pasemos contraste. So I will pass some contrast now. Contrast. Let me see where I am.
Ya, pasando con los dos.
No. So we are out. Okay. We are not in the anastomosis. Okay. There's no anastomosis there. Okay. So now what I will do now is to remove. Okay. La guía la vamos a dejar hacia la vía derecha. So I will pass my guide wire to the right. Very track. So I don't scare about this situation because this will be exactly as so I want to see where is my Biliary tract. So this is the Biliary tract. So my idea now is to go. Okay, so what I will do now is let's go to less here. Let's go to change. We will use the 9 French colonoscope now. I need that. See if I can. Because I want to remove the stand that is in the right very track. You see? Okay, we will do a exchange. Ten aquí. Empuja. Sí, empuja. Pásame el colonoscopio de 9 French y ahí cambiamos. Sí, dame un segundo. Momento. Momento. Retira la guía. Están ahí. Momento. Okay. So now we are good now. Okay, so this is a difficult case. I believe we can arrive to achieve use of magnets, but we need to send to make it 7 French magnets. That will be the solution to avoid a surgery. Cambia la guía.
Tem.
10. Ahí. Ok. Ok. Retira la guía. Empuja. Ten ahí. Empuja la guía. 10. Okay. It's very important the help of your technician, huh? To move on with this. Okay, so now let's do it here. Empuja la guía ahí. Allá, sigue. Sigue, sigue, empuja.
Está duro, tío, no.
Sí, ten ahí.
Ahí. Ahí.
Okay, so now ten ahí. So now we are fine. I need to see where is my stand in the right hepatic biliary tract, so it's here. You see? So my idea now is that empuja la guía ahí. No. No. Okay, so now not good. So I want to reach the right hepatic biliary tract. So I'm maybe, I'm not so sure. Mete contraste.
Otra.
So I will use contrast now. I will use contrast to see exactly where I am. What do I have to do?
Editando. Editando, editando.
Okay. Okay. Okay, para un segundo. Estoy aquí. Ahí fue. You see? Now I pass. Very good. So I will pass here. It's not easy, huh? I need to push more my guide wire. Okay. I believe we are right. We are very nice here. So I need to establish this communication now. No sé si puedes empujar. Right, perfect. You see? So now I'm very good now. Now I'm sure that I have a connection now. So push, empuja. I have a connection now with the right side. Okay? So this is very important just to left in place one stand, and I need to pass now. Empuja, empuja.
Podemos
As I will put the sphincteroton. Okay.
¿Quieres interesar?
Sí. Quiero inyectar allá.
Déjame la siguiente.
And then what I will do as a next movement is to remove the stand that I have from the right side to the stomach, and I will put just one stand. Okay? I will do a calibration. I had the chance because these two biliary tract were not together. Something happening in that surgery. I don't understand very well, but now I have the path from the right to the left biliary tract. So I think this is the future of the biliary tract management. Dr. Paloma doesn't say nothing. Huh? What happened, Dr. Paloma? Dr. Paloma is from Mexico. Huh? My fellow from Mexico. He doesn't understand nothing, I believe. ¿Sí entiende o no? Sí. So, as history, so the patient doesn't have communication between the right and left biliary tract, so I do it right and left drainage, but I had the chance when I passed through to get the communication. So now I can deal with one stand and not two, so that is better for the patient also. And then my third goal will be to try to do the anastomosis using magnets from the small bowel um, to the biliary tract. So I believe we can arrive to doing the third in a third procedure. So the advantage is that this patient have 16 years old. Now, well, to try to do a big surgery here will be very difficult. Then then I think I pass. Yes, I pass. So now quiero que inyectes. So now you see, now we have the right. Very, very nice. There is a divorce. The divorce is there. Oh, let me see if I have the divorce is there. You see? So now I have a communication. So I create a fistula also between the right and left. And that is very good. Toma esa foto. So, very difficult case. Tricky, but not impossible. So now I want to go there. Up. Very nice. So now I will empujar aquí. I will remove the other stent. I don't know why and how, but I will try to remove the stent. Let me see. Yeah, I believe I can arrive to do from far away. Maybe. You see where is my other stent? Ok, empuja bien, ¿no? Quiero la pinza del cuerpo extraño. Empuja bien. Sabes que dilatemos. So what I will do also is to perform a balloon dilation before to do that tricky situation. Just to be sure. Empuja. What? No, balloon dilation. I will pass a balloon, I will dilate, and I will remove the stent, and then I will put just one stent,
Would you like the endoscopy image?
For what?
For right now for the in
No.
Okay.
No, it's okay. Sí. So we create a fistula now. That's very good. The communication is good now. Tenemos uno de 7 French por 12 centímetros o algún doble pigtail 12 centímetros. I need a 12 centimeter stand because if not we will have oh my god. Oh, nice case. So people doesn't understand sometimes that this is not a normal ERCP. This is not a normal technique. We are working in the biliary tract in a different way with different materials. So this is very important to understand what we are doing. We are avoiding a liver cirrhosis in this patient and a big surgery. We had a chance. 10, 10, 10. Okay. Maybe we passed. Yes, we passed. Yes, yes, perfect. So now I will do a balloon dilation. Dilata, todo.
So the stages don't help you open up a little bit more.
Yeah, the idea is to have the fistula.
Dilatado.
To have the patency of the fistula that I create. You see? The communication. Because if I lose, I will not lose the path. I will try now to remove my stem, the other stem, the second one. And then I will put just one stem. Okay? Right, desinfla. So now we are perfect now. Perfect. Perfecto. Excellent. So I will use a 7 French 15 centimeter stand. ¿Sí tenemos más de esos?
No creo, pero
Hay que pedir más. Unos 5 hay que pedir. So now I need
ahorita lo ponemos directo,
no, necesito sacar el stand de abajo
¿no?
primero.
Es la guía. Tenga la guía.
Because
Al rato pásala.
without the stand I will not, with this stand I cannot
Fíjate que yo voy a armar el stand.
dame la pinza. So I will move quickly. Very nice case. This patient have a chance now. Okay, abre. Cierra. ¿Tienes algo? Sí, lo tienes. So you see, I have la imagen endoscópica en grande, ¿eh? Y la imagen fluoroscópica, endoscópica. So you see, I have the stent that is in the right side, and now I will move it. You see, because I need the space. So now I will move in another direction. Let's see. Oh my god, I lose my guide wire, I believe. Yeah, I lose my guide wire. Okay, don't worry. It's already ok, retira la guía. Necesito pasar el esfínter otomano. And it's okay. So now abre. Cierra. Okay. Ok, préstame el esfinterótomo. Esfinterótomo.
No, con la misma, solo más rápido con la guía diana y pasar el stand.
Puedes grabar video. So now
Estoy grabando.
I will pass again Let's see. Empuja la guía. Empuja la guía. Empuja. Sigue empujando. No. Empuja la guía. Oh my god, I believe I find the anastomosis. Let me see. I'm not so sure, but probably it's yes. Yes. This is a small bowel. I had a chance, just a chance. Too much chance. I find it. I found anastomosis. You see here? Perfect. So we have a lot of chance. Sometimes it's chance. Yeah, nice. Okay, so let's move. I need 10 millimeter. No, necesito un balón.
Vamos a ir a la.
Sí, no, necesito un balón para inyectar.
Ya, ya está.
Quiero inyectar desde arriba.
Tengo un balón extractor.
So we have the chance, huh? So we arrived to do the communication between the right and left, and then we, by accident, we fall. No. The technician was not the technician. Very nice case. Really very nice case. So now we need to do a calibration. Voy a usar solo una prótesis de 7.
O sea, de 7 por día, ¿no?
Sí. You see, now you see air in the Biliary tract. Yes, very nice.
What did you do, Chief? What did you do? Just to find the anastomosis?
Now I will calibration.
Did you correct the position?
No, I just fall inside.
I think maybe the
Yeah, maybe the other sand was also,
on the way.
on the way, and probably it was.
Did you correct the position?
No, I just had the chance. Just that. Sometimes it's blessings. Very nice. This is very nice. I need just to confirm because maybe in my way to do the right drainage, I moved something inside, and maybe I had the chance. That's why. So now I will infla, injecta. I need to see very well this. So you see there is communication now between the right and left, and now I see the anastomosis. It's perfect now. Foto. Sí. Necesito un balón de 10 milímetros. Infla. Ten inflado. Necesito desinfla. Inyecta. 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 Chut, justo cuando más necesito. Yes. Perfect. Okay. Puja. Dame un balón de 8 milímetros. Uno de vía biliar. Sí. No estoy seguro de que. Maybe this is just a fistula that. Desinfla balón. 6, 7 y 8. Ok, empuja. So now. So I will go slowly because I want to see. ¿Sabes qué? Pásame el colonoscopio de 7 French.
De 7.
Sí.
De 7, ya. El que te aprieta más.
I will see now. I'm sorry this is taking too much time, but it's important. ¿Qué le pasa, Gilberto? ¿Qué molesta?
Profe, analizando las cosas.
¿Qué está analizando?
Que muy bien,
¿Ah?
muy bien, profe.
Mucha suerte tuvimos. Creo.
Eso es la presencia número 100.
¿El número?
100.
¿Cuál es el número 100?
Vamos a tener que cambiar la guía pues, a 25. ¿Le pasa el de 9 no?
Pasamos por los lados.
Ah, ya por los lados, sí. Toma,
Oh no, pásame de nuevo entonces. Sí, pásame de nuevo.
toma. El que tenía, no. Sí, porque tengo guía.
So, you can see, sometimes we need to use two colonoscope just to see well.
Are any concerns if you put the stent to the anastomosis in the duodenum? Any
No.
concern that the right side might close?
No, I don't believe. We already do a balloon dilation.
Dilation, yeah. You can see contrast there in that communication, the fistula you created.
Yeah,
Yo tengo que
So that's still open there.
yeah. Even myself, I'm not so sure. You know, now I want to see what is going on. I'm, worried. Oh my god. Ya me pasamos esta vaina. Oh my god. Damn. So I want to see. 10. Ahí pasamos. Un momento. Sort of. Let's see. I have to be cautious. You see? Because I don't see like real anastomosis here. I believe this is we have the chance, you see? So I can pass now. Okay, so I will. I know that I am the biliary tract and I am in the anastomosis. What I will do is just to do a balloon dilation. You see here. So I'm not so sure if this is a natural fistula or if this is a 10. So I pass now. Very nice. I pass. So this is yeah. So this is anastomosis. Yes, I'm sure now. Now I can perform a balloon dilation now because I'm sure now that I need to be sure that this was the anastomosis. So sometimes you can have natural fistulas, huh? But this is anastomosis because I see biliary tract here. You see, you can see here, and here is anastomosis. So yes, perfect. Okay, so push. Sí, quiero hasta 10. So I will perform a balloon dilation until 10 millimeter of diameter. And then I will pass a stent. And this will solve, I believe, completely the situation of this patient. Very nice case, huh? Very difficult. We need to do we needed to do it two steps. First, to retire our patient from the cholangitis. And the second step, create, well, we had the chance to perform a communication between the right and the left, and that find the anastomosis that was already, you know, stenotic. That was a lot of chance. We had a lot of chance. So this will avoid a surgery, big surgery. Big surgery, 15 days of intensive care sometimes, with the risk of complications, you know. So it's this is a very good relief for the surgeons.
So yeah.
Very good. So once we perform the dilation, this will become better. Perfect now. Perfect. Dilata. So we will perform the dilation. I will go directly until 10. So yes. So the situation is what could happen. Sometimes you can perform some kind of. Until now, I didn't have it, but there is a risk of of leakage. You see, very well. But if it appears, it's not a big deal because we will put a stand, and the pressure will be. Oh, I cut. You see, I broken. Perfect. So if there is any leak, we will manage with a sand as we already do it. Desinfla un poco. So it's not a big deal. Ok. Ahora necesito que dilates ahí. So very good. I do a very good dilation now. I do, I don't know.
We did, yeah.
We did. We did. Okay. Desinfla. Okay. So we finish and I will put the plastic stand now again and I will retake in 8 weeks. Very nice case, huh? Important for this patient now. She have pain because the heart rate increase. And you will see now how the biliary tract will. You will see there in the biliary tract. Empuja. Now it's passing very well. You see? Very well. Perfecto. Very good. Sí. Very nice. Very difficult case.
The next time you retake it, do you attempt going from the anastomosis up?
No.
Always from here.
Always from here, yes. Too much time. We need to go by enteroscopy. It's not a good idea. It's better to work through the hepaticogastrostomy because it's easier to work by this way. So now we have the anastomosis reopen it, and that's a very good situation for the future of these children. Very good, my friend, very good. I'm very happy now. Okay, libera. Okay, perfecto. You see? Perfect. Huh? It's from the right to the left. So we finished now. I believe it's a very nice demonstration. We had the chance, and this patient will be solved. I will retake this stents, and we will see in 2 months how it's going on. So just one stent, and it's perfect. Okay, thank you so much. We close the transmission. Cerramos la transmisión. Préstame la pinza para retirar.